Quadriceps angle, commonly known as the Q angle, is a crucial anatomical measurement that helps us understand the alignment and function of the knee joint. It is formed by drawing lines from the midpoint of the patella to the anterior superior iliac spine and to the anterior tibial tuberosity. This angle reflects the force direction of the quadriceps muscle group on the patella, especially when the knee is extended. Typically, the average Q angle is around 14 degrees for men and 17 degrees for women. When the Q angle exceeds 15 to 20 degrees, it is often considered a risk factor for knee extensor dysfunction and patellofemoral pain. However, recent research suggests that the Q angle may not be as reliable a predictor of knee injuries as once believed. In this video, we'll explore the latest findings on Q angle variations and their relationship to knee abnormalities. Measuring the Q angle can be more complex than it seems. Traditionally, clinicians use a goniometer with the patient lying supine and the knee extended. Yet some experts argue that assessing the Q angle in positions that mimic real-life movement, such as standing, flexing the knee, or during dynamic activity, may provide more accurate insights. Studies show that the Q angle can change depending on body position, muscle contraction, and even foot placement. For example, moving from a lying to a standing position can slightly increase the Q angle, while knee flexion or muscle contraction can reduce it. The lack of a standardized measurement method makes it difficult to compare results across studies. As a result, more research is needed to understand how these methodological differences impact our interpretation of Q angle data and its clinical significance. Higher Q angle has long been associated with knee problems like patellofemoral pain syndrome, chondromalacia patella, and patellar subluxation. However, the evidence is mixed. Some studies report that people with knee pain or deformities have higher Q angles, while others find significant overlap between symptomatic and asymptomatic groups. Interestingly, not everyone with a high Q angle develops knee issues, and some with lower angles still experience pain. Factors such as muscle strength, limb alignment, and body mass also play a role. This suggests that the Q angle is just one piece of a much larger puzzle when it comes to knee health. It's important to consider individual differences and other risk factors rather than relying solely on the Q angle for diagnosis or treatment decisions. Research consistently shows that women tend to have higher mean Q angles than men, with differences ranging from about 2 to 8 degrees. This has often been attributed to anatomical differences like a wider pelvis, but recent studies challenge this assumption, suggesting that pelvic width alone does not fully explain the disparity. In children, Q angle values change with growth, and there is little difference between boys and girls. Additionally, the idea that Q angles are the same on both legs is controversial. While group averages may suggest symmetry, individual data often reveal significant differences between the right and left limbs. These findings highlight the importance of personalized assessment and caution against making broad generalizations based on group data alone. Q angle remains a topic of debate in orthopedic and sports medicine. While it is clear that extreme Q angle values can affect knee mechanics, the relationship between Q angle and knee disorders is not straightforward. The lack of standardized measurement techniques and the influence of multiple anatomical and functional factors make it challenging to draw firm conclusions. Moving forward, researchers recommend adopting more consistent measurement protocols and considering both group and individual data. By integrating Q angle assessment with other clinical findings, healthcare professionals can better understand knee health and tailor interventions to each patient's unique needs. Continued research will help clarify the true role of the Q angle in knee pathology and guide more effective prevention and treatment strategies.